let me talk about the respiratory medication here. So this is the table. We can find what are the different category of drugs we use for respiratory disease like COPD, bronchial asthma, bronchitis, or any other obstructive complication. The first group here, theophylline or aminophylline, it is actually xanthines derivatives. Then here, beta-2 adrenergic agonist. We use the salmeterol or salbutamol or Albuterol. So most popular drugs in USA, it is Albuterol or Salmeterol. This medication is very good for acute attack of chronic bronchial asthma and for the short time, and also onset is very rapid. Monteleukin we use for a long-term prophylaxis. And also another medication here, steroid like Fluticasan or Fluticasan or beclomethasone, corticosteroid or prednisone. Steroid can protect us to attack of bronchial asthma or COPD. They use as a prophylaxis. So here before go all of this group of medication, I want to explain a little bit about the pathophysiology. So in the picture number 1, we can see the upper respiratory tract, larynx, and trachea. So this is a common pathway for inspiration and expiration. So gas or air get in and expel out the carbon dioxide. So the trachea bifurcated, we call primary bronchi, and then they divided into 3 bronchi, and we have a right and left lungs. And finally, it is end in the lung alveoli. In the lung alveoli look like a sac where the gas exchange, oxygen and carbon dioxide exchange. In this picture, we can see this is the muscle layer, smooth muscle. And this one is a lumen. And also we can see the mucous lining and small blood vessel. It is a healthy airway. But when or attack of COPD or bronchial asthma or respiratory tract infection, any obstruction, the smooth muscle constrict and also lumen get narrow, inflammation occur, and secretion increase from lining epithelium, mucus secretion. So the pathway is totally narrow, difficult to passing the air. But when we give the medication like Albuterol, Salmeterol, or Theophylline, Monteleukin, or other bronchodilator like Fluticasan, all can work on it, and they relax the smooth muscle, reduce the inflammation, reduce the secretion, and causes the lung alveoli dilated and constriction relief and patient feel good. So all of medication basically work on it and the target to bronchodilation. In this picture, we can see healthy alveoli and bronchiole. There are no secretion here. In here, we can see asthma or COPD, excessive mucus secretion, they can blockage, and alveoli is permanently dilated. That does not constrict and relax. So air go in, but does not return back. Same thing here we can see the smooth muscle is dilated, constriction, and lumen is narrow and too much secretion, hypersecretion or exudate. Also disrupt alveolar attachment and patient feel bronchoconstriction. So they need the medication that can reduce the bronchoconstriction, they can reduce the inflammation and reduce the excessive secretion. So we need this group of medication, right? So let me explain. Which one the most important? All of them are bronchodilator. But asthma or COPD is a chronic disease. When acute attack occurs, we call acute attack of chronic disease or acute exacerbation of chronic bronchial asthma. So salmeterol or albuterol work on beta-2 adrenergic receptor or their agonist. So what are the use? Use for acute or severe asthma attack. So they will cause tachycardia or increase the palpitation or may cause the tremor, right? So now go for another drugs we use is called xanthin derivatives. Xanthin derivatives, and they are long acting. So theophylline or aminophylline, very severe condition, we use this medication. But commonly we do not use them because they have a many severe side effects. Like they can cause tachycardia or palpitation like salmeterol, but they can also cause dysarrhythmia or involuntary contraction of muscle, we call seizure. So this medication has a narrow therapeutic index. So chance to develop the toxicity, and we need to monitor the serum level. Normal level, therapeutic level 10 to 20. So theophylline is a xanthin derivatives. And when your patient take the theophylline, it is good. Tell them limit xanthin containing food. What are the food name contain the xanthin? Like coffee, cola, chocolate. So it is good to avoid caffeine, cola, or chocolate diet. So next group of drugs we use for bronchial asthma, it is Monteleucast. So Monteleucast are leukotrienes derivatives or modifier. Basically, Monteleucast we use for asthma, COPD, or exercise-induced bronchial asthma. If patient have a exercise-induced bronchial asthma, tell your patient to take Monteleucast at least 2 hours before start the exercise. Or we educate our patient to take Monteleucast at evening with food. What else? So tell your patient, do not give for severe bronchial attack, means acute exacerbation of chronic asthma. Monteleucast does not work. This medication takes a long time to work and give at the evenings, as I told you. So another drugs we use here is called Fluticasan. Fluticasan is a steroid. What are the other steroids we use? We use beclomethasone or corticosteroid. Most popular medication we use called prednisone or prednisolone. They are oral glucocorticoids. They reduce the inflammation. So do not give also for severe bronchial asthma attack. After opening, also it is very important, if your patient take the Fluticasan, after using, tell your patient to reach the mouth, raise the mouth, wash the mouth, right? So some of the medication, bronchodilator, can cause dry mouth. If your patient complain about the dry mouth, tell them to take sugar-free candy. What are the special note for NCLEX board? So always give bronchodilator first before you give steroid, right? So sometimes we prescribe bronchodilator albuterol or salmeterol inhaler and fluticasone inhaler. So out of these two, which one patient should use first? Definitely albuterol or salbutamol inhaler or inhaler first. Then tell your patient to wait 5 minutes, and this medication causes bronchodilation of the lung alveoli. And after 5 minutes, it is good to tell your patient to take Fluticasone inhaler. So then Fluticasone work better in dilated alveoli. And definitely after use Fluticasone, reach the better to wash the mouth. Otherwise, chance of develop fungi infection like Candida infection. So here the beclomethasone, it is the inhaler or it is glucocorticoid inhaler, right? And another medication orally we use tablet form is called prednisolone. What else? Now I'm going to show you another way of classification of drugs. It can help you. So beta-2 adrenergic agonist, bronchodilator, inhaler form, oral form, inhaler albuterol or salmeterol, oral form also albuterol or terbutaline. The common side effect, they can cause tachycardia, palpitation, right? And what else? Xanthin derivatives, already you know, theophylline or aminophylline. Anticholinergic medication, sometimes we use, most common one is pratropium bromide. Glucocorticoid inhaler or corticosteroid like beclomethasone, or we use also here Fluticasan. And oral medication, most common oral medication we use steroid is called the Prednisone, right? So it is very important to know that steroid has a lot of side effect. When I will explain the steroid, that times I will tell you what are the common side effect of the steroid. And other things is NCLEX board like to ask the question about the side effect of steroid. So if your patient have a diabetic, and if your patient take the prednisolone or prednisone, definitely they has to adjust the insulin doses. Steroid also can cause immune system suppression, delay wound healing, or growth retardation, or Cushing syndrome if patient take for a long time. Leukotrienes derivatives we call Monteleukin. And what else? Here, look. Here it is the inhaler we call meter dose inhaler, right? And here showing the spacer. So educate your patient to use the spacer. So the drug absorption will increase inhaler device. Here picture showing the meter dose inhaler without spacer, first picture, and second one with a spacer. So inhaled medication commonly used in bronchial asthma or COPD include beta-adrenergic bronchodilator or aerosol glucocorticoids. So now, how the medication works? Especially here, we are going to focus. So bronchodilator, how work? The sympathomimic bronchodilator relax the smooth muscle of the bronchi and dilate the airway and facilitate to gas exchange. Xanthin derivatives, how work? They stimulate the central nervous system and respiration, dilate the coronary and pulmonary vessel, and causes diuresis and relax the smooth muscle. The smooth muscle is the outer layer. So when this muscle is constrict, not dilated, the airway passages will be constricted like asthma. Not only the muscle constricted, inflammation occurs, secretion increase, and pathway getting narrow and narrow. Excess mucus, inflamed and constrict. So our medication can reduce the secretion, reduce the inflammation, and causes the bronchodilation. So used to treat acute bronchospasm, acute or chronic bronchial asthma, bronchitis, or any other restrictive airway disease like COPD. In here, we are going to get a special focus on theophylline. It is very important for NCLEX board. Let me talk about the theophylline. Theophylline increases the risk of digoxin toxicity. So digoxin is a drug we use for congestive heart failure or cardiac medication, right? or it is called cardiac glycoside. Very important medication for treat the atrial fibrillation or atrial flutter. But what is important? Digoxin therapeutic index is very narrow, and definitely every healthcare provider must know the sign and symptom of the digoxin toxicity. When you give digoxin and theophylline together, the chance of increase the digoxin toxicity and also decrease the effect of lithium and phenytoin. So lithium is a mood stabilizer, very important antipsychotic medication, and also phenytoin medication we use for seizure. But when you give digoxin with theophylline or lithium with theophylline or phenytoin with theophylline, the activity is reduced. Digoxin toxicity chance of increase. If the theophylline and beta-2 adrenergic agonist are admitted together, patient chance to develop cardiac dysarrhythmia and what is lead to cardiac arrest. Beta blocker, cimetidine or erythromycin increase the effect of theophylline. Beta blocker, atenolol, propranolol, it is hypertensive medication or gastric medication like cimetidine or antibiotic erythromycin. If you give with theophylline, increase the effect of theophylline. Barbiturate, it is the anti-anxiolytic tranquilizer, or carbamazepine decrease the effect of theophylline. This is the drug interaction. Now, what are the contraindications in individual with hypersensitivity? I mean, contraindication of bronchodilator or peptic ulcer disease or severe cardiac disease, because chance to develop dysarrhythmia. So used with some precursor on the client with hypertension, diabetes mellitus, or narrow angle glaucoma. Now let me explain a little bit what are the side effects, common side effects of all bronchodilator. They can cause tachycardia or increase the palpitation. Also, chance to develop dysarrhythmia, restlessness, nervousness, and tremor. All of these lead to anxiety, or anxiety lead to the restlessness, increased palpitation, and lead to tachycardia. Also, patient chance to develop anorexia, nausea, or vomiting, headache, dizziness, hyperglycemia. So if your patient took the bronchodilator like Fluticasan or Prednisone, chance to develop insulin level go up. So what you educate your patient? Educate your patient, adjust insulin. Also can cause dry mouth or throat irritation. Tell your patient to take sugar-free candy. Or sometimes can cause paradoxical bronchoconstriction with inhaler. Now, what are the intervention and what are the patient education? Last 2 points before to finish. So bronchodilator, if you prescribed or if your patient take it, we have to monitor the vital sign and lung sound. Is there any added sound or not? And also monitor the cardiac arrhythmias, bradycardia or tachycardia. check for cough, wheezing, or decrease the breath sound when you auscultate over the lungs. Monitor for restlessness and confusion. This is a common side effect. So educate your patient so they will be aware about it. Provide adequate hydration. Medication is administered at regular intervals. Oral medication are administered with or after meal to decrease the gastrointestinal irritation. Also monitor for therapeutic serum level, especially for theophylline. What are the client education? So, if patient not to crush enteric-coated or sustained release tablet, never ever, right? To avoid the caffeine contained product like coffee, tea, cola, chocolate, as well as over-the-counter medication. If patient take theophylline. About the side effect and adverse effect of bronchodilator. So tell your patient about the common side effect and how to monitor the pulse and report any abnormals or vital signs. So means patients are not stable. We must inform primary healthcare provider. What else? And also how to use the inhaler or how to use the spacer or how to use the nebulizer at home. We could educate our patient. How to monitor the amount of medication remaining in an inhaler. The importance of stop the smoking because smoking can cause bronchoconstriction. Smoking can cause cancer in the lungs. It is better to stop. So also monitor the blood glucose level if patient have the diabetic. So also wear a MediAlert bracelet. About the theophylline toxicity, likely occur when a serum level is higher than 20 milligram. So as I told you, theophylline can cause many serious side effects like dysarthria or seizure. So it is very important to need to monitor the theophylline level. This is more than enough about the bronchodilator. What are the medication we use for respiratory problem?